Hello, I'm Wendy Sofalo. I'm Director of Post-Acute Services at KSB Hospital. Today we're going to talk about a portion of those post-acute services, which is our KSB Supportive Care program. Today I'm going to be joined by Roxanne Kuhlmeyer, who is a nurse who works with us in our program, and Brittany Klein, who is an advanced practice RN, also a certified hospice and palliative care nurse. So post-acute services is kind of like an umbrella that has numerous programs underneath it. On the one side, we have home health care, which is a very specialized skilled services such as physical therapy, skilled nursing services, and others that fall under IDPH and CMS. We are not going to talk about that in depth today. What we're going to talk about is supportive care. Under that supportive care side of the umbrella, we have chronic care management, palliative care, and remote monitoring. Remote monitoring can be used as a tool to assist us in management of chronic conditions, both under chronic care management and palliative care, or it can kind of just stand alone and give us information to forward on to the primary care provider in management of those conditions. So the supportive care is at its very core a team effort. Primary in that team is the patient and the family. And the patient's goals are what really drives the care. What does the patient want? What does the patient need? What is the patient's highest concern? And those are the things that we, as the rest of the team, work at formulating a plan to help the patient meet those goals. It's combined with a nurse practitioners. We have three, Val Fouts and Jill O'Brien, as well as Brittany, are part of our team. We have a clinical pharmacist who works with us regularly, a medical director who's an MD. We have a social worker, a couple more nurses that work with us as well. Kelly and Sarah work with us right now. We also support the patient's primary care provider as well as their medical specialists. We have a respiratory therapist who meets with us weekly regarding patients who have pulmonary concerns. And as needed, we pull in other disciplines such as dietitians, physical and occupational therapy. So who is supportive care right for? Supportive care is appropriate for any age at any stage of serious illness. It's for anyone who wants to be provided symptom management along with curative treatment. It's for people living with serious illnesses, and that can be any area along that trajectory, from newly diagnosed to getting towards end of life. It's for people with troublesome symptoms such as insomnia, chronic pain, shortness of breath, vertigo, any of those symptoms, anything that might be troublesome and then disruptive to the quality of life. It's for people who are working to control their chronic conditions such as diabetes, heart failure, COPD. And it's also for patients that just want to stay out of the hospital, that have chronic conditions and who have had periods of exacerbation where they end up in the hospital and have to get that acute issue under control before they can go back home and continue to live their lives. And it's for people who want to meet their goals. They may have stated goals such as, I want to be able to participate in my children's activities or grandchildren's activities. And that would be an example of a specific goal. So I'm going to hand off now to Roxanne Kuhlmeyer, who is instrumental in our chronic care management program, and she's going to give you some more ideas about how that program works.
Hi, my name is Roxanne Kuhlmeyer. I am one of the nurses with chronic care management. Chronic care management is a Medicare-approved program that helps patients manage their chronic conditions. We do that by providing them a personalized care plan that's individualized to them with specific goals and interventions that help them meet their quality of life and improve their outcomes in life. We do try talking to patients a few days after their physician's appointments with their primary care physician to help them understand those recommendations, make them understand that why the doctor's doing certain things, are they doing the medications they're supposed to be doing, do they need to refill some medications, whatever we can do to support that patient as well as that primary care provider. Most insurances, actually Medicare, do cover our services without much of a copay, but there is always that opportunity, and always ask us questions if you need us to. I'm also going to talk a little bit about remote patient monitoring. That's a special tool that we do provide for patients with chronic conditions as well. Most of those patients do have some kind of heart failure diagnosis or diabetes or COPD. Patients get equipment that they have in their home to do those, monitor those conditions. They take their blood pressure daily, their weight daily, pulse oximetry, and we do monitor glucose readings with that as well. It is staffed by one of us nurses who provide real feedback time to the patients with those conditions, hopefully to keep them out of the hospital. Example would be if you're congestive heart failure patients and your weight increases too much in one day, we're going to be calling you and asking you a bunch of questions like, you have any additional swelling in your feet or legs today? Are you shortness of breath? Are you having any extra fatigue? That way we can let the doctors know those immediately and get you some hopefully help and not exacerbate those conditions and keep you out of the hospital. It's the main factor. It's the main goal in both departments, chronic care management and remote patient monitoring, and we have seen a lot of success with that. So next I'm going to give Brittany Klein, our nurse practitioner, to help finish her part.
Hi, my name is Brittany Klein. I'm a nurse practitioner with KSB Supportive Care. Our supportive care is a palliative care program. We specialize with medical care for people living with serious illness. We focus on providing relief of symptoms and any type of stress that may go along with the illness. Our goal is to improve the quality of life for both the patient as well as the family. Family is often caregivers, and they can experience a lot of caregiver stress. We have a social worker that can reach out to family members and provide additional support, as well as we have resources in the community to help patient and family as well. Our team, we're specially trained. We do have a medical director, multiple nurses, and we also work closely with your specialists, whether it is oncology or cardiology, and we just provide that extra layer of support. We help with coordination of care and symptom management as well. Our palliative care program, we focus on the needs of the specific patient. And I'm going to hand this back to Wendy for who is palliative care right for.
Palliative care is right for anybody with a chronic life-limiting condition. That can be a newly diagnosed diabetic all the way up to a patient who has cancer and might be facing the end of life. So if there are troublesome symptoms that are impacting quality of life, including depression, dementia, confusion, lack of appetite, lack of ability to sleep, any of those symptoms would be someone who could be benefited by palliative care. You can still pursue curative treatments on palliative care as opposed to hospice. You can be a full code. You don't have to give up your option to have full life support. So is this hospice? No. And as I alluded to, all of hospice is palliative in that hospice seeks to improve symptoms and improve quality of life, alleviate suffering. All of palliative is not hospice in that it's not, you can still pursue those curative measures. You can still take chemotherapy, still take radiation. You can still take anything that might be considered curative that would cure your disease and still have the benefit of symptom management. Patients who are not yet ready for hospice but want improved quality of life and symptom management can be benefited by palliative care as opposed to hospice. So frequently asked questions. Do you still see your doctor? Yes. How do we help you stay in your home? Patients are visited in the home. The nurse practitioner comes to see you in your home with your family and support system available. What does coordination of care mean? That means that our nurse practitioners, our RNs and nurses in the office are looking at all of the pieces that fit together to provide your care plan. So you may have a doctor who's not affiliated with KSB, or you see the physician in Northwestern and you see another specialist in Iowa City, KSB helps to coordinate that. Supportive Care helps to coordinate that, and transportation as well, making sure that everyone's aware what each aspect of the care team is doing, with the patient at the center, understanding the goal and driving the process for the team. The pharmacist is able to look at the medications. He is often able to suggest de-escalation of some medicines if patients are just tired of taking so many meds. He can make suggestions for changing either frequency or timing of medications to just make it more comfortable for the patient. Our social worker also helps to support patients in when they are experiencing bereavement, or families who are experiencing bereavement. So if you think you would benefit, or you think you know somebody that would benefit, what do? You can talk to your primary care provider and ask for their opinion and their referral to our office, or you can call our office and we can reach out for you. We're at KSB Hospital and our extension is 5710.